Good afternoon, everyone, and thanks for joining us today for an update on COVID-19 and the distribution of rapid tests. As most of you are likely now aware, in recent weeks, flu and other respiratory illnesses have increased in other parts of the country. Here in Newfoundland and Labrador, we are seeing some activity as well, although not to the extent that has been seen elsewhere. There have been increased calls to the health line and more visits to emergency departments for respiratory illness. We expect an increase this time of year and continue to monitor. There have been sporadic detections of influenza in Newfoundland and Labrador this season to date, and as yet, no influenza outbreaks have been reported. In a typical influenza season, we see sporadic cases detected before Christmas and usually peaking somewhere between late February to mid-March. Nationally, influenza activity is above expected levels for this time of year, so this could mean that we may see an earlier start for influenza in Newfoundland and Labrador. And while there have been some regional differences overall, COVID activity is remaining relatively stable. Indicators including test percent positivity, the number of new cases, and hospitalizations are relatively stable. So please be assured that public health is monitoring the situation closely, and as always, we'll base our recommendations on evidence and epidemiology. It is important to remember that over the last 2 years, we have developed the tools we need to respond to anticipated surges in respiratory viruses. Thankfully, what works for COVID will also work against flu, RSV, and others. We know that staying home when you are sick will help to reduce the spread of disease, and wearing a mask when you are around others for the 10 days after your symptoms start will also help to reduce virus spread. Being careful to avoid being around individuals who are at higher risk for severe disease, while you are infectious helps to protect those around you. It is important to do your own risk assessment when considering any activities and decide how you can reduce your risk, for example, by wearing a mask. Of course, we cannot forget proper hand hygiene, the cornerstone of infection prevention and control, and of course, vaccination. To enable individuals to make informed risk assessments and decisions, the Department of Health and Community Services will begin distributing free COVID-19 rapid antigen tests to households throughout Newfoundland and Labrador over the coming weeks. The rapid tests will be distributed to households through Canada Post, with each household receiving an allocation of 2 test kits, and that's 10 tests in total. And tests will arrive in 2 separate deliveries, with 1 box of 5 tests arriving each time. Using Canada Post will allow us to achieve a distribution of this magnitude as efficiently, cost-effectively, and most importantly, as equitably as possible. The rapid test will arrive in households throughout Newfoundland and Labrador between late November and early December. To ensure widespread community access to rapid antigen testing, supplemental distribution options have been established in collaboration with members of the House of Assembly of Newfoundland and Labrador and Newfoundland and Labrador Public Libraries. Residents who do not receive kits via Canada Post or who run out of supply will be able to pick up free rapid tests at constituency offices for MHAs and from all Newfoundland and Labrador public libraries. These locations will have rapid tests available by late November to early December. And we ask for your patience. It will take a little bit of time. As you can imagine, this is a huge-scale production. So, the Department of Health and Community Services is working with community partners to enable the development of further distribution options as necessary to ensure ease of access in all regions and for all persons in Newfoundland and Labrador. Some important things to remember about rapid antigen tests. They do not always detect COVID-19 on the first day or 2 of symptoms. If your first test is negative and you still have symptoms, take a second test 48 hours later. Rapid antigen tests are quite reliable if they return a positive result. Therefore, if you get a positive result, you have to assume you have COVID, and we ask that you follow public health guidance found on our website. We are asking the public to report any positive test results by visiting our website. This will help public health follow disease prevalence, and that will assist in critical decision-making on public health recommendations going into the winter season. So I thank you in advance for your support. This fall and winter, as people begin to transition out of pandemic mode and move back indoors and take part in many of the activities that we hold dear, we will see increases in respiratory viruses circulating in the province. This is expected and indeed happened routinely prior to the pandemic. The health system is prepared to handle surges such as this. Currently, we are not seeing the same epidemiology as some other areas of the country, and by working together, as we have done so many times in the past, we can reduce the impact these viruses will have on our communities and health system. We need to continue to use the tools we have to reduce the spread of all these viruses this year. One critical tool in this fight is vaccination. The respiratory virus landscape has changed. COVID will be a part of our lives going forward. As we have said before with flu, vaccination is a critical element of protecting yourself, your loved ones, and your communities. Vaccination can reduce spread of disease and reduce the risk of severe disease if you become infected. I know it is tempting to think that I'm just one person and my choice will not make a difference. I am telling you that is simply not the truth. Every vaccination counts. Making the choice to get a flu shot and to ensure that you are up to date on your COVID vaccinations will make a difference, and it is not too late. In fact, the timing now is perfect. COVID and influenza vaccines are currently widely available through regional health authority clinics and through your physician and local pharmacy. Please visit our website or contact your physician or pharmacy to book an appointment. Walk-in options may be available at some sites as well. I urge you all to make the choice to be vaccinated against both COVID and influenza. It has never been more important than now. Thank you, and I'll now take questions from the media.
Fitzgerald, through the last sort of COVID season, you resisted giving out rapid tests fairly widely to households. What changed your mind?
So I think, previously when we were looking at using rapid tests, we really were focused on a targeted approach trying to, keep kids in school, trying to protect the most vulnerable in our population, such as people who are living in long-term care facilities, so using them for testing staff in those facilities, as well as in the regional health authorities to help maintain our health system capacity. I think now as we've changed the way that we're dealing with COVID going forward, how we've changed sort of the public health management of COVID, this approach is really helping us. It's more suited to that, and it's allowing people to make that decision and be able to make informed risk assessments and informed decisions about their activities and things like that. So, I think as COVID has changed, we have changed in our response and management, and I think what we're seeing is just an evolution of that.
You mentioned that RSV and influenza, that sort of thing, those cases are rising in other jurisdictions. Is that in comparison to the years we were dealing with COVID, or is it in comparison to years before COVID and the rates there?
Yeah, so during COVID, we had hardly any respiratory illnesses. We didn't have much in the way of influenza. No, and we didn't see much. I mean, you would have seen some, right, in hospitals, but we weren't seeing anything really. So I think what we're seeing now is somewhat of an earlier season, an earlier start, especially with influenza, compared to seasons prior to the pandemic.
You mentioned, to follow up on that we're not seeing the same epidemiology as what's being seen in other parts of the country. Before, typically Newfoundland and Labrador was lagging behind by 2 or 3 weeks. Is that what's expected to happen here as well?
Yeah, generally speaking, that's true. We've always had a little bit later of a start, say, to our influenza season prior to the pandemic. And I mean, even if we see an earlier season, we would expect that it probably still will lag a little bit beyond what people are seeing elsewhere in the country. And that's just, the nature of how things spread. So we could absolutely, we do expect to see a rise in cases, and we're monitoring things very closely. But as I said, if we all work together and really people get out there and get vaccinated, we can reduce the severity of that surge, and we may be able to mitigate some of that risk of what they're seeing elsewhere in other parts of the country. So having that little bit of benefit of time can be, can be a really important thing for us.
Places where there's conversations about potentially bringing masks back for the winter months. Has that been a discussion at all about the mask mandates here?
Yeah, so mask mandates can really only only existed previously because we had a public health emergency. So under a public health emergency, we can bring in special measures orders that, like the mask mandate and some other things as well. So without a public health emergency, of course, the CMOH can't bring in any mask mandates. So we've certainly, been recommending that people do a risk assessment and decide if they need to wear a mask, and if you're going to be in situations where you feel that you're at increased risk for being exposed or having severe disease, that you do wear a mask. So that recommendation continues to be there for public health, and of course in our healthcare facilities we are still asking that people will mask. It is required there. So the recommendation may become stronger as time goes on and as we see changes, and of course obviously as we monitor and make our decisions based on the evidence, that may change as time goes on.
If you had the power to bring in a mandate, would you?
At this point, I don't think we have the evidence to support bringing in a mandate for masking. We're not seeing, we've had a few sporadic cases of flu. We're not seeing the same increases that we've had, that they're seeing elsewhere. So, we have to have the evidence to say that before you start infringing on people's rights, that you have the evidence to support doing so, and that there's really no other way to mitigate that risk. So, we know that people can voluntarily wear masks. That certainly will help mitigate risk. Washing your hands well, getting vaccinated, all of that can mitigate the risk.
What about in schools? Because we're seeing in other parts of the country, pediatric emergency rooms are overflowing with cases. Would bringing masks back for schools not prevent some transmission before we get to the point where we're seeing a lot more of those cases and we're seeing a strain put on the healthcare system?
So I think what we have to remember with these types of viruses is that you may reduce the risk of spread at the moment, but how long do you leave that kind of a mandate in place then becomes the question, because likely, as if we still see things circulating, when you take away such a measure, then you're going to see a surge in cases again. So, we have all of these things that we have to do. We're certainly monitoring things very, very carefully. If we see that there is, we get to a point where we really need to make that recommendation with regard to schools, then we've always followed the evidence previously, and we'll continue to do so, and I think we have the support to do so, but at the moment, we're certainly not there.
Sporadic detection of influenza. Do we know how many cases we've recorded?
I think we've had in the region of 7 or 8. Yesterday morning it was 7, so there may have been another couple today, I'm not sure, but.
When I was reading the data from public health in the previous influenza seasons, the flu tracker thing that they had, it said to approach that data with caution because of possible disruptions because of COVID-19. So I guess suggesting that it could have been higher, it's just that the testing wasn't in place. I've heard many people say, though, that we, as you mentioned earlier, that we almost got rid of it. Is that actually true? Or is it just that we weren't testing?
No, so we were testing for flu. When people came into the emergency departments, or people who were in long-term care, and if they were in hospital and got tested, they didn't get just tested for COVID. They got tested for flu as well. They do what we call a respiratory panel on that test, because it's important for us to know what the pathogen is. So that was happening, and that continued to happen all the way through. And in addition, there was some community testing for influenza that happened as well, and we just weren't seeing it, and that was the same across the country, really. The thing we have to remember is that through the pandemic there was just not a lot of travel, right? And that's how the flu basically gets here, is through travel, and it spreads across the country that way. So when people weren't moving, the flu didn't move either, so.
Any other things you would suggest other than recommending masking and hand washing, that sort of thing, Are there any other things that you would recommend in terms of having an immune system that is equipped to deal with these viruses that potentially will be here soon?
Yeah, so vaccination is the biggest thing that we can do, right? That primes your immune system to be able to handle these viruses. So, and while, as we've seen with COVID, they may not be 100% effective at reducing the spread of the disease, so you may still get it, they're certainly quite effective at reducing severe disease. So stopping you from getting really, really sick, giving you a quicker recovery time, preventing hospitalizations and deaths. So it's really important for people to get vaccinated and to be up to date with their COVID vaccination. So we have recommended that everybody get a booster. Everybody 5 and above get a booster. Obviously, the little kiddies are still getting their primary series, but we would definitely encourage parents to get their children vaccinated with their primary series and then to get their boosters for the fall. So everybody should be getting a fall booster for COVID, and really everybody should be getting flu vaccine as well.
What has the uptake been on both the flu vaccine and the fall boosters?
So flu is, I think it's in the mid-teens right now with regard to percentage. I haven't seen the latest numbers. They generally come out on Wednesdays. So we'll have more updates on that tomorrow, I guess, if you want to check back. And right now, COVID, it depends on the age group, of course, and people 70 and above, certainly we've seen good uptake with the boosters, but in the younger age groups, certainly we would like to see better uptake.
Do you know the cost associated with distributing all these rapid tests?
I don't have the number off the top of my head. I certainly wouldn't want to speak to it at this point. Good. Perfect. Thanks, everyone.